Hello everyone, my name is Calvin, and today, along with my team members Evan and Darryl, we'll be discussing how to alleviate poor mental health in Indonesia. Now, what is poor mental health? Poor mental health is when someone's well-being is not in a good state. It refers to alterations in thinking and mood associated with distress. They range from common problems such as depression and anxiety to rare problems such as schizophrenia and bipolar disorder. Generally, besides mental illnesses, people experience constant stress and not being in a satisfied state. Simply put, this is when our mental health is not what we would want it to be. Poor mental health can be caused by many life factors, such as socioeconomic status and the government people live in. As a practical example, the COVID-19 pandemic has been a major cause of mental illness. Mental illness can severely affect one's education, health, and life outcomes. Now, why would it be an issue worth discussing? According to UNICEF, more than 1 in 17 suffer from mental illnesses globally, and approximately 46,000 adolescents commit suicide every year. However, this extends to the rest of the human population, as 1 in 7 people are diagnosed with one or more mental illnesses around the world. The World Health Organization says suicide remains a major cause of death around the world, with around 800,000 cases annually. The underlying issue here is mental well being. Statistically, around 1 billion people suffer from poor mental health, and that value rose from 2017's 800 million. As a perspective, 1 billion people means that out of every 8 people, one of them is currently suffering from poor mental health. As mentioned earlier, the issue is very widespread around the world. Let me elaborate on that. In China, 17.5% of the adult population has some mood disorder, particularly depression. This is because of the low number of treatment of mental disorders, and the main issue here is the uneven distribution of mental health resources. In the United States of America, more than half the population will be diagnosed with mental illness at some point in their life, especially children. This can be because of childhood trauma and substance abuse. In Australia, half the population experience mental illnesses in their lifetime. The most prevalent are anxiety disorders and substance use disorders. The most affected are teenagers and young adults. This is a burden to society and causes high suicide rate. In England, a quarter of the population will experience a mental health issue. The most common mental illnesses are depression and anxiety, which causes higher suicide rates. 1 in 5 have suicidal thoughts, and 1 in 15 act on these thoughts. For a long time, Colombia was filled with conflict and violence, and is one of the least peaceful countries in Latin America. This has led to mental health struggles across the population, and many resort to suicide. Additionally, there's a lack of healthcare facilities in Colombia. As a team, we have discussed the different angles and views to counter this problem. I, Calvin, have decided to look at this issue from an economic perspective, where I'll be discussing about poverty. Evan looked into a cultural perspective, and he will discuss about the different cultures. And Darryl look into an ethical perspective, and he will cover issues relating to the unethical practices in the work environment. Let's start with the economic perspective. Before diving deeper, I decided to look into the problem from an economic angle. Mental disorders account for 30% of worldwide non-fatal disease burden and 10% of the overall disease burden, including death and disability, and the cost to the global economy is estimated to reach as high as USD 6 trillion by 2030. Large middle and low income countries like Indonesia struggle with a plethora of challenges in delivering adequate mental health care to its 270.2 million citizens. Centralized funding for Indonesian mental health is only 1% of the national health budget. Health expenditure is around 3% of GDP. Despite the government's effort, there's still a lack of mental health personnel and treatment for the many patients. Estimations based on the 2018 Basic Health Survey discussed thus indicate that there are 450,000 families in Indonesia with at least one member diagnosed with schizophrenia and possibly other mental illnesses. To make matters worse, instead of getting help, they are subjected to stigma, abuse, and shackling. Indonesia is a country with a high poverty rate for its size. 9.8% of the population lived below the national poverty line in 2020. They make barely any money to sustain their family, and their income is usually below $1.9. The underlying economic problem of poverty is a major cause of mental illness in Indonesia, especially because of how widespread it is. While Indonesia is a very poverty-ridden country a few decades ago, it has improved since then. For example, the poverty rate in 2003 was a whole 17.4%, but in 2020 has dropped quite a bit to 9.8%. Despite this, There are still many people living in destitution and in varying levels of poverty, such as extreme poverty and absolute poverty. Until now, Indonesia is still considered a third world country, which is still developing economically. Why does poverty cause mental illness? Job loss and income declines, which are drivers of poverty, often precedes episodes of mental illness. People living in poverty face substantial uncertainty and income volatility. They have to live every day uncertain whether they have food on the table, which causes major stress. It's not just food either. Some people don't have a roof over their head when it rains. They don't have any money to buy new clothes and have to use the same ragged shirt every day as they look for money. They are very prone to sickness, and of course, because of a lack of money, they usually can't get the treatment they need. Due to the poor infrastructure, those in poverty undergo severe material deprivation for basic things like food and water, as mentioned before. Poor infrastructure is another economic issue Indonesia faces. There is a lack of proper education and healthcare to help people with low incomes to have a chance to rise above poverty, which leads to a poverty cycle, but I'll get into that in a while. Mental illness is never caused by just one thing. Poverty can be one factor that interacts with genetics, adverse life effects, and substance abuse. In this manner, mental illness also stems from other issues caused by poverty. The issue with poverty is that it is circular, as in poverty causes poor mental health and vice versa. Poor mental health has adverse effects on the economy. The workforce will be unskilled and inefficient, which will in turn cause even more poverty. This is because they won't have the necessary skills and qualifications to perform well and compete in the labor market both locally and internationally. This will cause a perpetually low income for many groups of individuals, which in turn also causes more mental health due to its circular nature. It seems to be an endless loop. Indonesia is a country that suffers a lot from poverty and has been for a very long time. As mentioned earlier, just 2 decades ago, the poverty rate was almost 20%. Income inequality is another major economic problem in Indonesia. In my research, I have found that the four richest people in Indonesia have a very large amount of total wealth in the country. This can cause financial stress and other mental distress on a large scale due to income volatility and not being able to sustain a living for oneself or even worse, for their family. Many people are stuck in a cycle of poverty and a poverty trap. Since they can't get out of poverty no matter what they do, and their children and future grandchildren for many generations will suffer the same fate. In Indonesia and other developing countries, poverty is a major problem and it is very widespread. Poverty causes poor mental health because of the stress and uncertainty in income and availability of basic necessities such as food, shelter, clothing, and much more. Not only that, but poverty is difficult to get out of once you fall into it. So many generations of families get stuck in poverty. This is because the children do not get the right education and environment to grow and do well later in life. Stemming from this idea, this also has adverse effects on the economy in the future as the new generations of workforce and human resource and capital will be unskilled and of lower quality in the labor market. Additionally, not only is poor mental health caused by poverty, it can also be the other way around. The economy will suffer from an inefficient and unskilled workforce, and the cycle repeats again and again. Many problems like substance abuse and traumatic events may have cultural themes, but these problems are also caused by poverty. So poor mental health also stems from other issues caused by poverty, even the cultural issues and ethical issues like the ones that are going to be mentioned by my team members. Speaking of which, that concludes my section of the presentation. Up next, Evan will take it from here as he will discuss the cultural perspective.
Mental illness stigma is defined as the devaluing, disgracing, and disfavoring by the general public of individuals with mental illnesses. Stigma often leads to discrimination or the inequitable treatment of individuals and the denial of the rights and responsibilities that accompany full citizenship. Stigmatization can cause individual discrimination, which occurs when a stigmatized person is directly denied a resource, such as access to housing or a job, and structural discrimination, which describes disadvantages stigmatized people experience at the economic, social, legal, and institutional levels. In addition, stigma can prevent mentally ill individuals from seeking treatment, adhering to treatment regimens, finding employment, and living successfully in community settings. In 2001, the World Health Organization identified stigma and discrimination towards mentally ill individuals as the single most important barrier to overcome in a community. And the WHO's Mental Health Global Action Program cited advocacy against stigma and discrimination as one of its four core strategies for improving the state of global mental health. Attitudes toward mental illnesses can vary among individuals, families, ethnicities, cultures, and countries. Cultural and religious teachings often influence beliefs about the origins and natures of mental illnesses and can shape attitudes towards the mentally ill. In addition to influencing whether mentally ill individuals experience social stigma, beliefs about mental illnesses can affect patients' readiness and willingness to seek and adhere to treatment. Therefore, understanding individual and cultural beliefs about mental illnesses are essential for implementation of effective approaches to mental health care. Although each person or individual's experience with mental illness is unique, research has shown that certain cultures may be more vulnerable to mental health issues. Cultural stigma can make it extremely difficult for people affected with mental health issues to reach out for help and talk about the mental health issues and illnesses openly. Stigma can make it very demeaning for people with mental health issues to even try to reach out for assistance, as it can often be scrutinized by fellow family and community members. People can be stuck in a never ending loop of mental health issues, such as depression and suicidal thoughts, with no possible way out as they cannot receive any treatment or help. Poor treatment of people with mental health problems can be passed down from generation to generation, further solidifying mentally ill people in an endless cycle of hopelessness. Indonesia, like any other country or region, has a distinct culture that is unique to itself. Culture can cause poor mental health issues due to multiple reasons. Some examples can be cultural stigma, the lack of community support, the lack of resources for mentally ill people, and the way that people in the culture react towards mental health issues and illnesses. Some cultures will react extremely negatively to even the slightest talk of mental illnesses in countries such as Indonesia, Yemen, Mexico, and other developing countries. This negative perception of mental health issues will further encapsulate people struggling with them and will make it increasingly difficult to reach out for assistance or help. Certain cultures will even have communities shun, lock up, or even disown family members and friends with mental issues as they perceive them as being possessed or a sign of a bad omen. People, especially men with depressive and suicidal thoughts in these places, are often just told to suck it up or man up to the issue and endure it alone, as getting treated for mental illnesses can appear as a sign of weakness and bring shame to the family or community. Although many mental health problems can arise from economical and ethical issues such as poverty or a bad workplace environment, these issues themselves are often rooted deep within a nation's culture. This makes it extremely difficult to break the unending cycle of mental health problems faced by the population.
Mental health has become one of the biggest problems and challenges in the world and Indonesia. In Indonesia, mental health issues are not as important and not prioritized by the government and the citizens compared to infectious diseases and other criteria. Mental health is an important part of the complete state of health. Mental health issues may lead to loss of productivity and creativity and other physical health issues. A WHO report in 2017 stated a few of the problems related to human resources in the mental health field. Indonesia only reached psychiatrists rate 0.3.1, mental health nurses rate 2.52, and social workers rate 0.17, all per 100,000 population. A study from the University of Erlangga made it clear that some health services in provinces in Indonesia were lacked of mental health services. From 685 public hospitals owned by the government, only 32.5% of them had psychiatry services, with just 8% had inpatient services. All the evidence from the research confirms that Indonesia is lacking mental health resources and services that helps patients with critically low and poor mental health. The average human spends approximately 90,000 hours of their life in the workplace. That's a significant amount of time. The workplace may be a source of self-fulfillment or happiness for a lot of people and employees, but it can also cause serious health issues if it is toxic or unethical. One of the ethical themes that cause poor mental health is about the workplace behavior. Unethical workplace behavior is any action at work that goes against the prevailing moral norms of a community. At work, unethical behavior can take multiple forms and have multiple targets. From minor to severe, all people can behave unethically, hurting societies, organizations, colleagues, and even the self in the process. Many studies show that unethical workplace behavior is not only prevalent in most organizations throughout the world, but also extremely costly. Things like a poor working environment could negatively affect workplace morale. This ultimately leads to things like subpar job performance, health issues, and poor communication, which causes frustrations, depression, and stress. Poor mental health brought about by unethical employees in the workplace could cause a range of serious medical conditions like hypertension, diabetes, and other health conditions. As well as having a huge impact on individual employees, poor mental health has severe repercussions for employers, including increased staff turnover, sickness absence due to debilitating depression, burnout and exhaustion, decreased motivation, and lost productivity. While most companies of all shapes and sizes increasingly understand the importance of a good mental health, many simply don't feel confident handling and communicating these issues in the workplace. Having poor mental health in the workplace could lead to a lot of different problems. As stated before, due to the lack of motivation and lost productivity, employees and employers that were the victims of unethical workplace behavior will work less productivity and thus resulting in less income and profit for the company and themselves. The workforce will be more ineffective and inefficient due to decrease of productivity. A research paper from the Centers of Disease Control and Prevention stated that depression caused by a lot of reasons such as unethical workplace behavior interferes with a person's inability to complete physical job tasks about 20% of the time and reduces cognitive performances about 35% of the time. When the workforce is much more inefficient, there will be less money for the employers and employees. Due to this, the employees that have poor mental health caused by unethical workplace behavior may and will be affected by it. This problem causes them to have less money, which will cause much more stress and poor mental health, and the cycle goes on further. Unethical workplace behavior is an enormous problem and a widespread problem in Indonesia and the whole wide world. It causes a lot of problems and issues that can affect a lot of different types of people. If a worker experiences and have poor mental health, they will be less productive and the issue is circular. I do believe and acknowledge that my team and I have great causes and themes that causes poor mental health which varies and are very different, but in my opinion, unethical workplace behavior is the main cause of all my team members' causes. Thus, that is why I truly believe that my cause is the ultimate cause. Thank you for your time.
To conclude our video presentation, poor mental health is a very serious issue that is prevalent to this day. It is caused by poverty because of a lack of basic human needs or infrastructure, which causes financial stress as well as generally a low well-being. It is also caused by the cultural upbringings that we all face, as it will stem to other problems like discrimination and stigma. This can lead people to become afraid of speaking out and causes an endless cycle of fear and silence. The trauma they experience over their lives, such as during their childhood or adolescent days, will be bottled up and can seriously damage one's mental health. Lastly, it is caused by the unethical workforce practices such as exploitation, harassment, and bullying, which can lead to a low morale and unnecessary stress. However, obviously, these are only the problems that we have analyzed. There are many other problems which causes poor mental health. Now, how should we overcome this problem? First, we must realize that mental health is just as important as our physical health. Our body needs a healthy mind to survive and function after all. Many people in every community seems to not realize this yet, and they undermine the true importance of a healthy mental state. We should take initiative and raise awareness. Together, we can stop this issue.